Here is your stem. Remember, there are two slides. Once you read this one, please say it. I'll change the slide.
Okay.
Do you want me
Okay,
to
ma'am.
change? Yes.
Yes. Okay.
All right. So if you've read and understood, considering it communication skills station, please begin.
Hello.
Yes, hello.
I'm Dr. Mahir, one of the ST1 doctors working in London Hospital with Mr. Man. I'm calling to speak to the cardiothoracic consultant to refer one patient with widened mediastinum. Can I check I'm speaking to the cardiothoracic consultant?
Yes, can you summarize your case?
Yes, I have this 23-year-old man, known case of diabetes, presented as a case of RTA in a motorcycle accident. Clinically, the patient has right chest pain, and on arrival, his GCS was 14. His Glasgow Coma Scale was 14, and his heart rate is 120, and blood pressure 100/80. His temperature was normal, and there is left thigh swollen. We did investigation. His hemoglobin is 8, and his urea and creatinine was normal. In the pH, he have acidosis in his pH, and his chest X-ray show widened mediastinum. His abdominal X-ray showed absence was shadow, and he have left femur fracture in the shaft. So we gave him 4 liters of crystalloid, and we inserted chest tube in the right side, and we prepared also 6 units of blood. So we think that this patient is having aortic dissection, and we hope that to transfer the patient for your care for definitive care and definitive
Okay.
management.
Okay. What will you do for cervical spine?
Yes, I will fix the cervical spine using hard cooler, neck cooler, and 2 sandbag and tape.
Okay. Do you think is the patient in shock?
Yes, he is in shock.
So what is the type of shock patient may have?
He may have hypovolemic shock, obstructed shock due to the widened mediastinum, which will be a cardiac tamponade, or yes, and he could also have cardiogenic shock due to the cardiac injury.
Okay. What will you do for leg?
Yes, I will fix the leg in Thomas split.
What will you do for the blood pressure?
Yes, we started fluid resuscitation, but we adopted careful resuscitation with our target blood pressure systolic not more than 100, in order to avoid any dislodgement of hematoma, which could be fatal.
Okay. Why is the patient having the metabolic acidosis?
Yes, he is having left femur fracture, and it's closed, so maybe he's going into compartment syndrome. And also another cause is he's having hypovolemic shock, and also he's diabetic. So I am concerned about he may have DKA as a cause of acidosis.
What other investigation would you like to add?
Yes, I would like to add CT abdomen and CT chest, and also CT brain, but it is not available in our hospital. So it will be very helpful.
Okay. What image will you do?
Yes, I told you the CT, but I also would like to do echocardiography and ECG for the chest.
What
For the heart.
about the about the abdomen?
Yes, for abdomen, I will do CT abdomen with contrast if his renal function test is going to be okay at that time.
Okay. What about the shadow? What do you think?
Yes, this absence source shadow is delineating that there is intra-abdominal collection. So the patient may need laparotomy for this collection.
Okay. What are his blood abnormalities? Do you expect
Yes, he
it?
have low hemoglobin, and he have this metabolic acidosis.
Who will accompany the case?
Yeah, I will speak with ITU registrar or anesthesia registrar, and yes, I will ask him to accompany the case. I will try the company to come with a case. I will be very happy to come with a case, but I will make sure that there is someone covering me at my position in the hospital.
Why do you refer this patient?
Yes, this patient is having widened mediastinum. So I think this patient is having great visual injury or aortic injury, which causes this widened mediastinum. So we need to treat this first.
What does this indicate?
This
Okay.
indicate either great visual injury, aortic dissection, traumatic aortic dissection, or cardiac tamponade.
Okay. What will you prepare the ambulance during the transfer patient?
Yes, I will prepare the ambulance with critical care set and also CPR set and also with infusion pump and yes.
Okay. If the patient needs intubation on the way, who will do it?
The anesthesia registrar will do the intubation.
Okay. What is the source of bleeding and hemorrhagic shock in this patient?
Yes, first the mediastinal bleeding, which could be the great vessels, and also his abdominal collection, which could be a major injury to the vessels, and also his closed femur fracture. So he have three causes of injury of bleeding.
Okay. What type of shock patient has?
Yes, as I told you, he has having a hypovolemic shock, and maybe he's having also cardiogenic or obstructive shock.
Okay. You suspect a major vessels injury. Why chest tube drain only 200 ml of blood?
Yes, that's because the chest tube is inserted in the pleural cavity, and the blood from great vessels will be in the mediastinum.
Okay. What is the definitive measurement of aortic injury?
Yes, this is either endovascular repair or open surgical repair.
Okay. If traumatic aortic injury, which part it's usually injury?
Usually the proximal part. Sorry,
Okay.
the distal. Yes, the proximal part. Yes.
Proximal. Yes.
Okay. If widening mediastinum done to cardiac tamponade, what is the treatment?
Yes, this will be repair for the injury from the vessel, or if wide from cardiac tamponade, then we'll do pericardiocentesis, either CT guided or ultrasound guided or open.
Okay. What other investigation would you like to add?
Yes, as I told you, the ECG and the echocardiography for the heart.
Okay. You can refer the patient now.
Okay, thank you very much for your time and for your cooperation.
Okay.
I will keep you updated about the case.
Thank
Okay.
you.
Thank you.